Hi, my name is Samantha Berns. I am 22 years old and I have Niemann-Pick Type C or NPC. I would like to thank the Parseghian Foundation for giving us this opportunity to speak about our disease and the FDA for joining us today. I live in Stillwater, Minnesota with my parents and our dog Lewis. I have two older sisters who are carriers of NPC. I was diagnosed at 16 years old after 1 year of testing. Before I had any symptoms from NPC, my life was normal. I enjoyed grade school. I had a great group of friends. I spent many nights at sleepovers, birthday parties, or just hanging out with my friends. I played soccer, basketball, and tennis. I was constantly active. I also spent a lot of time with my cousins and sisters, playing in our backyard. When I began junior high, things began to get more difficult for me. I was having a hard time with a lot of my schoolwork, and I needed help from my parents to complete my homework. I was eventually tested and I got on an IEP. I still participate in sports like the Nordic cross-country ski team, but I had a hard time with my balance and coordination. At that time in my life, I remember always being tired. I still had some close friends, but it wasn't like it had been in the past. My family noticed that I was less talkative and engaged. This is when my parents became concerned and I started seeing doctors. My parents got my diagnosis on Christmas Eve 2012. I was a junior in high school and it was a sad time for me. I knew I wasn't going to be able to go to college like my sisters and friends, and I couldn't find a part-time job that I could do because of my disease. It was also difficult to think that I would probably always live with my mom and dad. That was 6 years ago. Currently, I fly to Chicago every 2 weeks for medical treatment. I have been doing this for almost 5 years. During that time, I've maintained my cognitive and physical abilities, and some have even improved. I have a part-time job that I love. I digitize adoption records dating back from the 1950s. I socialize with my coworkers and sometimes go out on outings with them. I am able to drive myself to work as well as drive in my community, like to Starbucks for a coffee. I also work out 3 times a week doing cardio, lifting weights, and working on my balance with my trainers, Chris and Jill. My treatment has also let me regain the ability to do other physical tasks, like walking in a straight line and using chopsticks. Even though I live with my parents, I am very independent. I take care of all of my grooming and daily medications. Most importantly, I now have a fuller life. My family and friends tell me I'm more talkative since my treatments began. When I travel, I am able to better keep up with my family, which makes me happy. I can have new experiences and create memories. My goal is to enjoy as normal a life as possible and to not lose any more of my abilities. Thank you.
Good morning. My name is Jenna Wheats, and I am from Morrison, Illinois. I have been married to my husband, Brad, for 10 years, and we have 2 beautiful children, Claire, who is 8, and our son, Jeg, who is 5. Today, I am representing our son, Jeg, and he was diagnosed with Niemann-Pick in December of 2017. When Jeg was 2 years old, our diagnostic odyssey began. We started to see a pediatric GI specialist at the University of Iowa because Jeg started to develop perianal skin tags. It took 2 years of the symptoms getting worse and more painful, an upper and lower scope, a biopsy, and at the age of 4, Jeg was officially diagnosed with Crohn's disease. It was during all of his visits to the GI specialist that they found Jeg's enlarged spleen and with no explanation as to why it was enlarged. In 2017, he was sent for a genetic workup that was screening for a couple different diseases, but they thought that NPC was unlikely to be the cause. We didn't think much of it, and we left 2 days on a trip to Disney World. On our last day of vacation, I received a call that brought our whole world crashing down on us in the middle of Hollywood studios. I learned that our son had NPC, that his disease was fatal, and that there was no hope of saving him. If you didn't know any better, Jeg appears to be a very normal 5-year-old boy. He is funny and smart, sensitive, loving, and full of life. He loves to sing and dance, play baseball, and ride his bike. We find that just about everywhere we go, people gravitate towards him, commenting on how special he is. Brad and I are beyond blessed to be his parents. Jeg has very few symptoms of NPC at this time. He has a slow cognitive response time, a small amount of eye gaze palsy, and his running and jumping are not on track with other children his age. The only symptom right now that impacts his life is his enlarged spleen. He wishes to take part in sports, like wrestling and football, but the risk is too great. We travel 2.5 hours, one way every 2 weeks, missing a day of work and school for Jeg to receive treatment for his NPC. Every day we watch him, monitor his schoolwork, watching for any signs that his disease is progressing, just waiting for the other shoe to drop. Right now, Jeg's Crohn's disease has more of an impact on his life than his NPC as we struggle to get it under control. We have to travel to Iowa City for him to receive an IV of an immunosuppressive drug. The infusion takes about 3 hours total for him to receive, and it is an additional 3 hours total of driving, once again causing us to miss work and school. For the last 6 months, he has also been on a steroid, which we are trying to reduce now. When you have a child with diseases like these, nothing is simple anymore. When Jeg started all-day school this year, it meant explaining to the nurse, teachers, aides, and principal what his needs were with his bathroom requests and what the symptoms of his NPC looked like. His doctors are a part of a team that is publishing a case study on Jeg. In the study, they have noted that there is a connection between Crohn's disease and NPC, as other cases are documented. Jeg's case is unique because he is one of a few cases where his IBD presented before his neurological symptoms of his NPC. Usually it is the other way around, and his doctors are suggesting that NPC should be tested for in every case of very early onset inflammatory bowel disease. Jeg's case also shows how important it is for every child with an enlarged spleen and Crohn's disease to be tested even in the absence of neurological symptoms. We were asked what our family hopes for in terms of future treatment options. Anything that will delay the progression of this horrible disease and improve the quality of life those affected will have as the disease progresses. Our greatest hope is for Jeg to be able to live life with NPC, but manage it much like people with diabetes do. We hope that with the FDA's help, a family diagnosis of NPC someday won't be such a tragic one. Thank you so much for letting us tell our stories and for listening to us today. I hope that we can all work together to provide treatments for our sweet little boy and all those affected by NPC so that they will be able to live a life that they deserve.
Good morning. I'm Phil Marella. My wife Andrea and I have 4 children, 2 of whom were born with NPC, and like many families, we started our life together with expectations of unending joy. But then NPC changed our priorities. Our second oldest, Dana, was a beautiful, fun, caring, and insightful little girl. As an infant, her doctor felt just the tip of her spleen, but it would come and go. Still, that led to specialists and many tests, including a painful bone marrow scrape to check her for leukemia. They found no cause, decided it was likely a viral reaction, and we were told to go home and enjoy our daughter. But then at the age of 5, we were stunned to hear that Dana was falling well behind the other children in school. And that started a 3-year journey of seeing specialist after specialist with no answers, until that terrible day we learned that Dana had NPC, and were told that there were no treatments available, and we had only another 5 or 6 years with her. The time between the skin biopsy to the NPC confirmation was excruciating, and the confirmation was a gut punch. With the amazing efforts of this community providing our first experimental treatment and drug trial, Dana was with us another 12 years. But they were not easy years as Dana declined. Seizures, a special walker by the age of 9, a wheelchair and feeding tube by 12. By the time Dana was 14, she couldn't walk or talk, got all of her nutrition and medicines through her feeding tube, and required 24/7 care. Even after she no longer spoke, she always greeted people with a smile, and she loved to hold hands. The last 5 years were the toughest, with multiple pneumonias, long stays in the hospital, eventually needing a trach and a ventilator to breathe, until one fateful week during a seemingly good period, just before her 20th birthday, suddenly Dana's liver failed and she was gone. Our youngest child, Andrew, like Dana, had the occasionally enlarged spleen at less than 1 year old. And while Andrea and I both feared the worst, we hid from the possibility that Andrew also had NPC. Yet with the start of the first drug trial, we knew we had to know for sure, with the chance that he could get a head start with that experimental treatment. So just before his 5th birthday, we received the terrible news that Andrew also had NPC. But it was the right choice because we believed that with the help of that medicine, Andrew thrived from 5 until 14. People rarely noticed any difference between Andrew and his friends. With the help from a second drug trial, Andrew is still an amazing speller and very good at mental math. But NPC is a relentless disease. 3 weeks after Dana passed, Andrew, a 14-year-old boy who would walk home from the school bus, play baseball and flag football, starting having multiple seizures per day. Andrew now has gait, balance, occasional swallowing issues, but we don't know if it's NPC or the side effects from all his anti-seizure medicines. And of course, with the loss of Dana, he expresses fears for his own future, no matter how encouraging we remain. Andrew's seizures now average about 1 every other day, but Andrew cannot be left alone, cannot move around the house or anywhere else without someone by his side. So in one day, his entire world was turned upside down. It has been almost 6 years since we lost Dana. We think of her every day. It's those memories and the faith that Andrew and the other patients here and everywhere will be the first ones to see a cure for NPC that pushes us to help unlock the answers to this terrible disease. Thank you.
Hello, I am Elizabeth Heinze, and my husband and I are the parents of 4 beautiful children, 3 of whom have lost their battle to Niemann-Pick Type C. Our experience with the disease started when our oldest son, Tyler, could easily walk or even run forward, but was not able to sidestep or walk backwards. After 3 years working with one neurologist very persistently, we were referred to her instructor. Tyler was diagnosed from a neurologist that had only seen this disease in one other patient in his 30-plus years of experience. By this point, Tyler was progressing pretty rapidly. It seemed as though every year we had a new piece of equipment, a new symptom that we were treating. 1 year from the date of Tyler's diagnosis, our youngest received her diagnosis. And 6 months later, our middle 2 girls got their results, with one being a carrier and the other NPC positive. Each of our NPC kids experienced many of the same symptoms, yet each child experienced these in a much different manner. They all had falls, with Tyler needing helmets to protect his face and head. All 3 children also eventually needed a walker, but our youngest child, Faith, that ended up to be dangerous. She loved to run anywhere possible, and if she got away from you, she was sure to tumble over, walker and all. Our children needed a stroller for long distances, and eventually a wheelchair was insisted upon by the school for their safety. To us, this was like writing their death sentence, because we knew that the less mobile they were, well, if you don't use it, you lose it, so they would eventually not be able to walk well at all. So at home, we would walk them with assistance. All 3 kids benefited from a feeding tube due to choking, and with each, they had their trouble with that also. Frequent leaking, bed and clothing changes, sour belly all over the bed, and of course the floor. Katie was known for unplugging her tube and climbing out of bed, only she was not able to climb anywhere, which resulted in her laying on the floor next to her bed in a pool of formula. She was sneaky, and even with bed rails and a video monitor on her through the night, she would escape. All 3 kids also had seizures. They started with small stirring episodes, then petit mals, and eventually grand mals. They also each experienced cataplexy, that if you made them laugh, although it was such a beautiful sight and sound, they would lose all tone and control in their trunk and would face plant onto whatever was in front of them. It was a blessing that Tyler was wheelchair bound before he started this, but Faith started early. And she would be standing and start giggling, and she would hit the floor flat as a pancake. We learned that if we thought she was going to laugh at something, we needed to be ready to catch her. Their laughs were contagious, and all 3 kids would grab the attention of even the most unlikely passerby. Once the seizures started, we were never able to control them enough to stop them altogether, even with frequent med changes. So they became our normal. All 3 of the NPC kids did not know how to express pain. Tyler never cried when he fell or got a new bruise, or for the 4 sets of stitches that he had. Katie broke her arm and had no tears, and Faith tumbled from the couch, broke her forearm, both bones, and never cried. Katie was very frustrated. I think that she didn't know exactly what was happening, but she really wanted to be independent, and NPC doesn't allow for that. She was also a perfectionist, and that doesn't exactly go hand in hand with a neurological disease either. Tyler and Faith both just went with the flow. As they each got older and taller and harder to handle alone, they required more equipment, like a gait trainer and a Hoyer lift. We were blessed to get an added bedroom and bathroom that was set up for when Katie had really bad days, and eventually we used it for Faith. Not one of us here asked for this to be our life, but knowing what we were able to experience and how much my kids have taught me, I would do it all over again just to give them the best possible life. Thank you.
Hi, my name is Judy DeSouza, and I'm from Connecticut. I'm here to talk about my daughter, Brianna. She was my only child. At her birth, she was born with jaundice and an enlarged liver. The neonatologist cautioned it might be something more, but her growth seemed normal. She met all her milestones. It would not be until she was 9 years old that she would be diagnosed with Niemann-Pick Type C. My daughter was such a joy. She was very sociable and loved to sing and dance. Symptoms of the disease began for her at 2nd grade. Her handwriting started to become illegible. Her running seemed awkward, and she would fall down when laughing. Her speech started to slow down. She was asked by some of the kids, why did she talk so funny? She would ask me why she had to be so different. When we learned she had NPC, I, as her mother, felt relieved and glad to have finally been given a diagnosis of what she had. We had gone so long without knowing what it was. I totally did not give much thought to the doctor's words of no cure because I suddenly had hope that this disease had a name, that there was a foundation of people to connect with, doctors and researchers working on a cure. Her father, on the other hand, was upset and said, "What is there to be happy about? There is no cure." The loss of hope would not hit me for several years. As Brianna's ability to eat, walk, talk began to decline, I had to learn to let people help me. By the time she was 6 years old, her dad and I were no longer together, and she lived with me. I had to hire a live-in caregiver 5 days a week to assist me with Brianna, to get her off and on the special needs school bus, to bathe her, dress her, to tube feed her, to give her routine medicines, etc. When I got home from work at night and on the weekends, I would take care of Brianna myself. When Brianna was in the pool or the beach, she would love to swim around with an inflatable tube. And you could tell she felt normal, as much as a normal life we could have. Around the age of 12 years old, when she was no longer able to talk, I would send in notes to her teacher to explain what we did that weekend together. The lack of verbal communication was hard. As Brianna began to have trouble swallowing, the next step was the feeding tube. Parties were difficult when Brianna could no longer eat by mouth. It seemed that every celebration involved food and lots of it. As time went on, she would regularly cough up a lot of phlegm, so I would carry a towel with me wherever we would go. She often slept more, which I believe was partly due to medicines, fatigue from a mentally and physically draining of her energy to get through each day's activities, and a lot of depression. She managed to tell me once that she was sad that she could not do anything anymore and that her hopes and dreams were not going to come true. Sadly, Brianna died in 2006 at the age of 14 years old. To me, the hardest thing is not to have hope. Hope is everything. If there was a potential therapy that could have prolonged her life and given her a good quality life, and it had come in time to help my daughter, this is what I would have wanted. Unfortunately, she declined to the point that as potential therapies were starting to become available, she was not able to take part. I tell Brianna's story here in the hope that there will be hope available for other children and families affected with the disease now and in the future. Thank you for listening.
I'm Cindy Parseghian, the mother of 3 of 4 children who lost their lives to Niemann-Pick Type C disease. Last summer, I was looking for videos for a CNN show on NPC that aired in August. For 2.5 days, I was immersed in my children's lives, my family's journeys through photos and videos. It has been easier over the last 13 years since we lost our last daughter, Marcia, to focus on the laughter, the smiles, the hugs, the love, as opposed to the falls, the choking, the seizures, the pneumonias, the bruises, the tears. In the past, it has helped me to try to glaze over the painful memories of my children's lives and concentrate on their smiles that glisten from their photos. Michael dressed as a cowboy or heading off to karate. Marcia dancing. Krista adorned in purple, her favorite color. It has been a coping mechanism that has allowed me to try to forget the pain my children endured, that all NPC children endure. Thankfully, we have many pain-free, joyful memories of each of our young children, when each child was the most beautiful ever, healthy, alert, with the requisite 10 toes and 10 fingers. Our dreams and hopes for them were boundless. But as the years moved through the videos, the NPC symptoms started creeping in with very many poignant moments. The jagged bob of the head, indicating an eye movement problem, a vertical gaze palsy. The unexplained enlarged spleen, first noticed in 2 of the children when they were toddlers, one as an infant. Their gymnastics coach referred to Michael as Belly Man. The slowing of the speech, the stumbles, the black eyes on Michael after a significant fall. I watched Krista collapsing after laughing too hard from cataplexy. All 3 of our children suffered from cataplexy and grand mal seizures. The seizures started around age 9 and seemed to occur more frequently when the children were tired or suffering from a cold, the flu, or pneumonia. Then there is Marcia, no longer able to stand by herself in her beloved dance class, supported by a friend or being twirled in her wheelchair. There were the mechanical apparatuses that started appearing, the leg braces, the walkers, the wheelchairs, the breathing equipment, the feeding tubes. There were the wonderful and always necessary school aids by the children's sides. Our unaffected son, Era, gently playing, having a pillow fight with his younger brother, being cautious not to hurt him, knowing his 9-year-old brother didn't have the dexterity to protect himself. The picture capturing Krista's spastic toes, one last time, as she lay dying. And Marcia, without her best friends, Michael and Krista, telling me she knew she wouldn't grow up. The videos forced me to relive the horror of watching NPC cruelly steal my children's lives, finally culminating in videos made for their memorial services. Michael died just days before his 10th birthday from a seizure early one morning in his bed. He had started having seizures about 9 months before, but the medications never totally controlled the episodes. A seizure led to his suffocation early one morning in his bed. Michael was the first to show signs of the disease when he was 5-ish. His speech became slow. He couldn't keep up with the other kids on the playground with his stumbles and falls, leading to several trips to the ER for stitches. And he couldn't quite look me in the eye. It would take a 2-year journey through various doctors' offices to finally get a diagnosis. Our youngest, Krista, was the next to die. From birth, she was always more frail than her siblings. By the time she was 2, we knew that whatever Michael had, so did Krista, as her gross motor skills, including jumping and running, were impaired. She struggled with pneumonia for several years. A dear friend described her breathing, due to her scarred lungs, as cooing like a baby dove. At 10 and a half, she could fight no longer. A feeding tube had been inserted 4 months before she died, but it was probably too late to offer her the nutrition she needed to stay strong. She hated the feeding tube, pulling it out several times before she died of pneumonia. Marcia would live until she was 16 and a half. And yes, when you have a child that has a fatal disease, you don't count life in years, you count them in months. Marcia was physically the strongest of our children and the slowest to show symptoms. Her diagnosis came as a surprise. She was the first to skip in her dance class, tie her shoes. She was reading before she entered kindergarten. Yet by the end of first grade, she had already fallen academically behind her peers. In a wheelchair by 12, it held her crumbling body, but not her soaring spirit. Maybe she lived to an older age than her siblings because we worked hard to maintain her lung capacity with breathing treatments several times a day, even when she wasn't suffering from pneumonia. Or maybe it was the nutrition through a feeding tube that was inserted when she turned 13. Yet in the end, she too would succumb to pneumonia. Our journey has been one of pain and joy. The pain of losing our child to an insidious, horrible disease, and yet the joy of having him in our hearts forever. Thank you.
Well, first of all, thank you all very much for sharing such moving insights and helping to illuminate some of the important observations. And what I've tried to do is capture themes, and we'll do that as we go through moving towards a summary at the end of the day. Despite differing onsets, the relentless progression of every day impacted, the concurrent illnesses and the complexities they cause from seizures and anti-seizure medicines, and a kind of teeter-totter of hope and setbacks. The one thing I'm impressed with all of your comments is that NPC hijacks the independence and normalcy of patients and their families. So understanding how to quantitate that and capture that is important.